Good evening, everyone. Welcome back to my channel. My name is Dr. Ada Zion. Thank you for following me to this point. In commemoration of the World Malaria Day, I'll be talking of malaria in pregnancy. As we all know, malaria is a public health issue globally. It affects everybody of all ages. But in pregnancy, I'll be talking about that because it affects my constituents. Now, it causes morbidity and mortality in pregnant women. Morbidity means it causes illness that may prevent the person from being productive, and mortality means that it can cause death in pregnant women. It's a global issue. Remember that in pregnancy there is decreased immunity. This decreased immunity, as in the body tends to reduce its ability to fight disease. This happens mostly in second and third trimester. Now, malaria also causes lower immunity in pregnant women. So, what happens in pregnancy is that malaria loves the placenta. We call it placenta parasitemia. So, when a pregnant woman gets malaria, what happens is that the malaria will go to the placenta and inhabit and live comfortably even when the woman does not have symptoms. So it will stay in the placenta and will be trying to infect and affect the baby directly and indirectly. Malaria burden in pregnancy can cause a lot of havoc. It's been found out that it causes 10,000 maternal mortality and 200,000 neonatal deaths annually, and these deaths, 80% of it happens in Africa. There are four species of malaria infection. You know, malaria itself is caused by a genus of Plasmodium. That Plasmodium has four types. You have Plasmodium malariae, Plasmodium vivax, Plasmodium ovale, and Plasmodium falciparum. Plasmodium falciparum is the commonest, and that's what affects most pregnant women. Plasmodium vivax is almost nil in Africa because of lack of Duffy antigen, where it tends to attach. It's like a receptor. But Plasmodium falciparum is what causes most of the havoc that we see in pregnant women. Patients that present with malaria can come with the following symptoms. Pregnant patient, that's what I'm actually talking about now. They may come with fever. They will not say, I have this fever that is worse at night or worse in the morning. But the good thing about the fever is that it's intermittent. Maybe in the evening it's very high. In the morning, the person will get himself. In the evening it's very high. In the morning, the person will get himself. So we call it intermittent. It's not continuous. It gives you a sign that the person has malaria. The person may even come with bitterness of the tongue. The person may come with other symptoms like weakness, prostration. If it becomes severe, a lot of other things will happen. So malaria affects pregnancy in diverse ways. Number one, because of effect of malaria in a pregnant woman, what happens is that it goes and inhabits the red blood cells. In that red blood cell, you see, it comes into the body and starts attacking the red blood cell. It wants to live into that place. Because of this adherence of red blood cell to the malaria falciparum, what it now does is that it live there, make the red blood cell rigid. Red blood cell is supposed to be malleable, to meander, to move around the system, the vessels. Now, when malaria parasites inhabits the red blood cell, it tends to make it rigid, and because it becomes rigid, it becomes useless. Now the body starts to break down the red blood cell, and the more it breaks down the red blood cell, the more it releases the malaria parasite into the system, and the more the symptom increases. So it causes red blood cell, then it causes suppression of bone marrow. So when somebody initially, if you have blood loss, your bone marrow tends to increase its production of red blood cell. But malaria goes and attacks all red blood cell of all ages and causes bone marrow suppression. Then the person may come with anemia. You now be doing blood test, and you see that the person's what we call hemoglobin level is even low, so the person may come with anemia. Now the second thing, and this anemia is not good in pregnancy because it may affect the baby. Now the second thing it can cause is hypoglycemia. Hypoglycemia means the blood sugar level is very low, and if it becomes very, very low, it can affect the system and even lead to death. So malaria causes red blood hypoglycemia, and it does this by struggling with glucose with the body. It causes liver impairment of glucose. We call it gluconeogenesis becomes impaired. Now the drug you use as well uses glucose. The liver becomes suppressed to produce glucose. The body itself, your own body, also need glucose. So without this thing causes hypoglycemia. Anybody that has malaria, we advise that you eat very well. Eat glucose containing food. It's not time to start eating to watch your weight. No. Now other things that may happen is that malaria in pregnancy can cause, it becomes so severe, prostration. The person will be so weak, cannot get up. Severe symptoms can cause pulmonary edema when it enters the vessels of the lung and gets squeezed there. Fluid will tend to accumulate. The person will not be breathing well anymore. Oxygen saturation will decrease. We call a lot of things associated with pulmonary edema. Malaria infection in pregnancy can cause even renal failure. If it goes to the vessels of the kidneys, it can lead to acute renal failure. It can lead to jaundice. That is this sclera, this white thing will become greenish or yellowish because the body tends to break much red blood cell that it will not be able to remove it from the body. Remember also that the liver is also trying hard to work well. So these things will now lead to yellowness of the eye. Malaria in pregnancy should not be advised. Then fetal complications include, when it crosses to the baby, it will lead to spontaneous miscarriage. In first trimester, malaria can cause miscarriage. It can cause, when the pregnancy has advanced, it can cause intrauterine growth restriction because it suppresses oxygen supply, nutrient supply, blood supply to the baby. The baby may not grow optimally. It will reduce in size. We call it intrauterine growth restriction. It can cause preterm labor. Before 37 weeks, before 9 months, you see the woman coming with labor pain that if you don't do anything, the baby will come out. It can even cause fetal death. It can kill the baby inside the uterus. Malaria is not good in pregnancy, and WHO, World Health Organization, has proposed 3 ways to stop malaria in pregnancy, and these ways include: number 1, sleeping under insecticide treated net. You see that net that you refuse to buy in the market, please go and pick it up. Make sure you sleep under net as a pregnant woman. And if you want to do it because we partner with the pediatrics, the babies, make sure your baby sleep under insecticide treated net. We want to avoid contact with malaria, with that mosquito that carries malaria falciparum, as much as possible. Sleep under insecticide treated net. Then we also advocate intermittent preventive therapy for pregnant women. Intermittent preventive therapy for women that are pregnant, we give that every 4 weeks. Then for case management, now prevention, all this will try to stop contact with malaria. Then we give you preventive treatment for pregnant women. We treat cases that have been seen. For pregnant women that you are pregnant, we start giving you intermittent preventive therapy with sulfadoxine pyrimethamine, except if you react to sulfur drugs. That's why we don't give it. So we give it from 13 weeks or from any time you feel quickening, when your baby start moving. We give it every 4 weekly till delivery. Then we treat you if we find out you have malaria. How do we find out? We can do blood film. We can do rapid diagnostic test. Blood film may not pick it when it's just in the placenta, but rapid diagnostic test may pick it for us. We cannot do other investigation if it's affecting other parts of the body. These are the things we do to stop to find out that you have malaria with the symptoms. We combine it with the symptoms, we now treat you. If you now come with malaria itself, we treat you. There are drugs that we use, artemisinin combination therapy, quinine, they are okay. When you have malaria, we also treat you for other causes. If you are pregnant and you are vomiting excessively that you cannot even take orally, we will not give you oral drugs. We give you injection for malaria before we now treat you with your other drug. We also give you drugs, things that will resuscitate you, peradventure that you are already complicated, that the malaria is complicated malaria. But if it's not complicated, we can treat you on outpatient basis. So malaria in pregnancy should be avoided as much as possible, should be controlled, and should be treated. I don't want you to lose that baby. I love you. Subscribe to this channel, like this page, share, subscribe to my YouTube, follow my page on Facebook, my Instagram at OBGYN Talks with Dr. Adazayon. God bless you. Thank you for watching.